Hello, everyone. My name is Bronte Johnston, and I am in my second year of the Health Sciences Education's Master's Program. And today I'm going to talk about my thesis regarding the greater impacts of point-of-care ultrasound training for midwives, which is under the supervision of Dr. Beth Murray Davis. This project came about with the 2018 College of Midwives of Ontario scope expansion, which allows midwives to perform ultrasound with the appropriate training. For a bit of context, point-of-care ultrasound, or POCUS as I will refer to it moving forward, is an ultrasound scan performed by a non-sonographer health practitioner. In a recent Ontario Midwives Needs Assessment, it was found how there was a desire for ultrasound and how it would help the midwifery profession provide more holistic and better client care. With that, a course was developed between McMaster's Midwifery Education and the McMaster Mohawk's Medical Radiation Sciences program, with its first cohort starting in fall of 2019. With this, the research question for this project was, for Ontario midwives, what are the educational impacts of the McMaster Mohawk point-of-care ultrasound course for primary maternity care providers? The course started with 5 online modules which covered topics such as ultrasound physics. Learners had to complete a quiz for each module and obtain 80% before attending the 2-day workshop. In this workshop, we included lots of practice scanning time before all the assessments. And then finally, the 18 winners then went to organize a clinical practicum where they completed a logbook of scans for evaluation before receiving a letter of completion. As this is an education-based project, we employed the Kirkpatrick model to evaluate learning through a 4-level framework. Levels 1 and 2 refer to the participants' thoughts about the training, while learning is the increase of knowledge. Levels 3 and 4 focus on deeper learning with regards to how has the curriculum changed the participants' behavior, such as are the participants using POCUS within their practices, and how has it changed the midwifery profession. Our methods were triangulated and were collected concurrently but analyzed separately and were then compared and combined to generate a rigorous evaluation. Quickly, they included 5 semi-structured interviews which took place in spring of 2020, 4 surveys which contained 5 and 7-point Likert scale questions and open-ended responses spanning from pre-course to 1 year post-course. Our research analyses used descriptive statistics and grounded theory methods for quantitative and qualitative results, respectively. Our results revealed 5 major themes of facilitating learning, improving care, addressing barriers, refining the role of the midwife, and serving community. For the purposes of today, I'm going to talk about 3 themes of serving community, improving care, and refining the role of the midwife to showcase the greater impacts of this training. Throughout the study period, POCUS integration grew to 56% in Survey 4. 78% of participants shared how they would continue to use POCUS in their practice at the end of the study. The majority of participants felt that POCUS provided better, more accurate care and that this additional clinical information led to faster diagnoses. Up to 70% of survey respondents stated that they thought POCUS was beneficial for their clients. POCUS could also provide an opportunity to improve health services in underserviced regions. One participant explained how they hoped to use POCUS in a new rural community where they were going to establish its first midwifery practice. In another example, a participant stated, "Our small practice is rural and clients have many barriers to care, including financial, transportation, and geographic isolation. The hospital we refer to is an hour-and-a-half drive away. Quick access to POCUS would improve care for our community." The majority of participants respectively agreed that POCUS improves client care. One participant thought it was of great value to have midwives do obstetric ultrasounds because we also have the ability to interpret it in a clinical way right away for the client. The clinical indications that participants reported using POCUS the most frequently throughout the 4 studies included assessing fetal presentation and confirming viability of the first trimester. Midwives also felt that by being able to gather more clinical information, their clinical decision-making would improve, and therefore they may need to have less transfers of care or less diagnostic tests. The long-term impacts of education are what clinical learners take from their new learning and apply to their clinical practice. Participants shared how ultrasound could help in other perinatal services such as abortion care, intrauterine pregnancies, and obstetrical emergencies as well. Midwifery as a profession is continuously evolving to provide optimal client care. The clinical practicum was seen as an essential opportunity for continued ultrasound practice and for participants to ask further questions to refine their POCUS knowledge. 44% of participants felt competent in POCUS and 50% were comfortable in performing various indications after extensive training. However, throughout the interviews, comments were made about the general public's minimal knowledge of midwifery. With the novelty of POCUS in midwifery, there were concerns that the public would not know that a midwife could have sonography training. Additionally, participants felt they required proof of certification to validate their POCUS skills. At a health policy level, participants reported that midwives are generally underutilized in healthcare systems. Participants felt policymakers have minimal knowledge of midwives and their clinical capabilities, resulting in them being left out of policy decisions that impact perinatal care. Having midwives being able to perform more clinical duties would not only expand their skill set, but hopefully allow the public to understand their extensive training in the perinatal period. So how does this all connect back to the Kirkpatrick framework? The results I have shared today really connect to the upper two levels of the Kirkpatrick framework, behavior and impact. Consistently, we saw how POCUS had changed our participants' clinical behavior as they had started to use this technology in their clinics. The wider impacts in client care were illustrated by how supportive and grateful midwifery clients were to have POCUS technology used in their care. Further, POCUS opens more doors that would allow midwives to perform additional health services to better serve their communities. This project suggests the importance of POCUS in midwifery and understanding midwives' applications of these skills. Our project demonstrates the need for continuing education within midwifery and how beneficial new technology can be within clinical care. This information will also help inform future course revisions to be more reflective of midwives' needs. Thank you.